Yo. Hello, everybody. Welcome once again to your NoCD Wednesday night webinar. Now, normally we would be doing a Wednesday night Diversity Matters webinar, but we're moving that to next week, just so we had a little bit more prep time on that. So that will be next week, where we will have our Diversity Matters series. So today we will just go to our normal thingamabob that we do with all of the OCD minions, all of you out there, where you pepper me with questions and I attempt to use my sage wisdom to assist you in challenging that pesky little OCD of yours so that it will scamper on off into the sunset and hopefully not return very often to you. Although it is like a bad penny and comes back once in a while. So let's take a look at what do we got. Hello, sir. Hello, sir. Thank you. What is the treatment for sensory motor OCD? Is ERP or something else? I've been victimized by it for a year. I'm worried about the feeling of constant touch on your clothes to your body, your spectacles on your nose. Spectacles, I like that. Obsession on breathing, surrounding noises, smell, and so on. Well, I would do purposeful exposures to those things, to wear scratchy clothes and to maybe wear a certain smell or bring it with you of some kind, a cologne or something like that, and allow yourself to realize over time that there will be points where you won't be thinking about it. You won't be focusing on it. Sometimes we've prescribed the problem to people. I've done this with people before who are afraid of focusing on their breathing. Say, what if I spend all day thinking about my breathing or focusing on my breathing? So I'll say, all right, here's your assignment. I want you to do nothing else all day long but think about your breathing. And then after a few minutes, they'll be like, I wonder what I want for lunch. Oh, wait, no, shoot, I'm supposed to be focusing on my breathing. So go back to focusing on the breathing again. And it turns out to be a very difficult thing to do, to focus on the thing that's really the problem for you when you're told to focus on it. It becomes a much easier thing to do when you're trying not to think about it, and then it pops into your head. So what I want you to recognize is that when something pops into your head, when you're probably not thinking about it, but then it does pop in there, you have a choice. Do you go down the path of paying attention to it, or do you acknowledge it and move on? You have heard me say here for the last several weeks, the idea of acknowledge and move on is a big thing that we need to really work with people on doing. What can we do to help people acknowledge what's going on in their life? How can we acknowledge the OCD? How can we acknowledge those obsessions? How can we acknowledge the desire to do a compulsion? But then move on and not have to do so much about it. Just let it go, right? Let it be. And if we could do that, we start to get better. So that's what I would suggest. Maybe purposeful prescription of the problem. Maybe during this entire webinar, try to only think about your breathing and not anything that I say whatsoever. And I'm going to bet you're going to find yourself listening to things, and then you'll be like, oh, wait, I'm supposed to be focusing on my breathing. What does it prove to you? You don't actually have to be focusing on your breathing the whole time, and you can get distracted from it. And if you can, then you can get to a point where you don't even pay much attention to it as well either. Davey says, sometimes the OCD can create convincing feelings that you actually want to or have to do the feared thing. How do you avoid reassurance seeking in those really scary moments? Okay, so Davey, I'm going to do what I've done in the past. Right now, I want to run across the street and throw a Molotov cocktail into my neighbor Dave's house. Hi, Dave, if you're watching. Be on the lookout, Dave. Could be coming. And then I'm going to go into the middle of the street, poop in the street. I'm going to put it into a bag. I'm going to light the bag on fire. I'm going to go to my neighbor Josh's house over here, and I'm going to put the bag in front of his door. I'm going to ring the doorbell. He's going to come out, see a fire, smash it, but then get poop on his foot, and I'm going to laugh about that. And then on the way back to the house, if there's any geese or birds flying over, I'll shoot them with a rifle, and then when I come in, I'll have now set a house on fire, made someone have a fiery, poopy foot, and I'll have killed a few birds along the way. Now, how much reassurance do I need that I won't do that, would be my question. How much do I have to tell myself that that thing isn't going to happen? Now, you might say, okay, well, you're not really convinced that, but OCD makes it really convincing. And I would say to you, how does OCD make something really convincing, right? What does OCD tell you that's different than what anyone or anything else might tell you? How does OCD make you believe something's true? And maybe that'll be our question for tonight. I'm going to throw that out to everybody. Maybe tonight we'll do something slightly different than we've done in the past. How does OCD actually convince all of you that something is true? That's number one. And part two of the question, and I'll only discuss them from the chats if you answer both parts. Number one, how does it convince you that it's true? And number two, how many times then has it actually happened? Okay, because what we'll want to show then is if it's convincing you something's true, but it's never actually occurred, then it wasn't actually true, was it? Let's take a look at that tonight. So I'll give some people some time to write about that. Crusher says another weekend with the boss. Well, thank you, Crusher. Good to see you again. Mark Andre, should people like us have kids? Because I know how a personal hell OCD can be, and I wouldn't want to be responsible for giving genetically this illness to my future kid, but I want kids. Well, you have many options, right? Number one, if you have children, here's what we know. A first-degree relative has a chance of about, up to around 20% chance of somebody also being a first-degree relative of them having OCD. So that could mean to your children too. So now you have to make some decisions. Are you willing to take that kind of a chance to work with someone? I'm so used to, it's been a long day. Are you willing to take that kind of chance to have a child who might have obsessive compulsive disorder? Are you willing to take that chance? That's a very personal decision on your part, okay? There's adoption, but you may not know the entire genetic link of the child that you're adopting. So there could be some chances there as well too. I have never told anyone not to have a child, right? What I have said to people who have OCD who are considering this is, let's do everything that we possibly can to help get your OCD, to the minimum amount that we can get it, so that OCD doesn't play a role in you rearing your child. And if we can do that, if we can get it to where OCD doesn't play a role in your child rearing, we're handling the other part of this very well, which is it's not just the genetic aspect of things. It is also environmental stressors and things that go on as well too. So you may have a high genetic predisposition towards something, but never actually develop it because you didn't have the right stressor to kick it off. You may have a very low genetic predisposition to something, but have a stressor appear in your life and you do get it. There are people who have no OCD in their family who have children who have OCD. There's people who have no autism in their family who have children who have autism. Should we say to everyone, no one should have children because they might have a problem? Or do we say to people, anytime that we have a child, of course, there's a risk for something could go wrong. It could happen. But you know what? There's risks in everything that we do where something could go wrong. Every time that you go driving, something could go wrong. There are people who have gone out for a car ride just to get ice cream who were killed in a carjacking incident, right? It could happen. So do we stop everything that we do and not breed or love or date or drive or marry or anything because something might go wrong? When I got married 5 years ago, I did not expect within a year and a half of getting married that my wife would get very, very ill and get diagnosed with a terminal cancer. So should I tell everyone else in the world now, you know what, don't get married because your spouse could get sick and die? Should I tell people that? Or do we all take risks in no matter what it is that we do? I can't tell you that if you have children, they won't have OCD. I don't know. And I can't tell you that they will have OCD. Who knows? It is a possibility. But there's also lots of other possibilities out there as well, too. And that's why it becomes a very personal decision on your part to make that choice. How do you know what is actually dirty versus just OCD? Well, I look at it this way. I clean my kitchen once a week, right? And after meals, I wipe things down. I wash my floors probably once a month. I change my sheets probably once every 2 weeks. To me, if there's a visible stain on something, then I could do something more often. But otherwise, I just kind of have my ways of doing things. I could say that every night I sleep in bed, if I didn't take a shower before going to bed, then that means that I'm transferring the dirt that I built up all day long on me onto myself, now is getting into my bed. So would I want to lay in my bed again tomorrow on sheets that I haven't changed because maybe my bed's dirty? Well, you know what? I'm going to be 50 this year, and I have lived with changing my sheets every couple of weeks. And believe me, when I was in college, it might have been once a semester, if at all. Who knew? Who knows? I have survived. I have not been killed by it. So I'm thinking my ability to know when something's dirty is basically been along the lines of, if there's some visible dirt or grime on it, that's when I've considered it dirty. And that's when I do some active cleaning on something. And otherwise, there are things that I do just for general maintenance. And I go with that. Hell, I don't even leave the house anymore, really. So like shirts, I'll wear a shirt 2 or 3 times before I throw it in the laundry now, because I'm not really going out. I'm not sweating in it. I'm pretty much sitting here, right here all day. This is a lot of my activity you're looking at right now. So what is dirty? Some people will say, well, once it's been worn, it's dirty. Okay, maybe. But it could also be, I haven't spilled my lunch on my shirt yet, so it seems to be pretty clean to me, and I'm good with it. Again, very personal kinds of things. But there potentially is something in this question, which is, give me an exact way of knowing something's dirty or not. And that's what OCD would like, right? If you tell me 100% for sure when to know something's dirty or not dirty, that'd be great. But then because you have OCD, it's not like you'll believe it anyway, because I could even give you an answer to that and you say, yeah, but what if? Yeah, but what if? What about that? What about? It wouldn't really matter what I tell you. You're not going to believe me anyway. I've been having feelings like I mean my OCD thoughts and they make me feel horrible. What should I do? Well, then feel horrible, right? And learn that you can feel horrible for a while and let it pass. And after it passes, recognize, okay, well, I got through that. Cool. Now I know how to deal with the fact that, yeah, my OCD is going to make me think that I mean something and it's going to lead me to feel horrible, but wow, I can handle it. Well, that's pretty awesome. Well, you just stole the thunder from OCD when you do that, right? I mean, maybe I really mean my thought that I'm going to go across the street, throw a Molotov cocktail into Dave's house, then I'm going to poop in the middle of the street, put it in a bag, light it on fire, take it over to Josh's house, make him come outside after ringing the doorbell and stomp on it. He's going to get a poopy, fiery foot. And then I'm going to come home, and on my way home, I'm going to shoot some birds in the air and leave them just laying out in the neighborhood with some dead geese that fly over my house all the time. And I'm going to come in my house and I'm just going to laugh. How horrible should I feel right now about that? Because that's my thought right now. Should I feel bad? How can I determine how much I mean it? I mean, I have some bottles of alcohol in here, and I have a way to light them on fire, and I have some cloth that I can put in there. I have the means for the Molotov cocktail, and I could probably stir up a poop if I needed to. And I got a paper bag, and I could light that on fire, and I have means to shoot some birds if I wanted to. So, I have all the makings for everything I just said. I wonder now how likely it is. How much do I have to actually mean something for it to actually happen, right? How much do I have to actually mean something for it to be a dangerous thing? Is there a level of of meanness or intentness in something, that once I cross this threshold of intentness, now it's really bad, right? If it's under that level of intent, it's okay. But if I have OCD, can I ever fully judge my level of intent the way that I want it to be? Or is there always maybe some wiggle room on intent in that as well too? I think we're discovering here that we have a lot more questions than answers when we have OCD. Now, that may be very, very disappointing to people, because people with OCD say, well, if I just had the answer, everything would be great. But can you ever get the answer that you want when you have OCD? No. You know why? Because you have the doubting disorder, and the doubting disorder doubts everything and will never believe any answer that you tell it anyway. So to try to give OCD an answer that it will believe is to try to count every grain of sand that's on every beach in the world, right? It is a futile task, and it will get you nowhere. Well, just a reminder, everyone, this is brought to you by NoCD. NoCD, a downloadable app brought to you by NoCD, as I said, which you can get on Google Play or iOS. And you can use our teletherapy service across the United States and in the UK now. So we're very excited that we're there now as well too. So reach out to NoCD at treatmyocd.com or nocd.com and let us see if we might be able to assist you. There's some hellos there. Oh, let's see. Jump around. Let's see if anybody has answered my challenge so far. Doesn't look like it. Yeah. Okay. I'm still putting my challenge out there to everybody. Okay. Let me go back up here. One momento. All right, there we go. Ever since I've heard there was a link between OCD and autism, I've developed an OCD obsession with it, despite not having any traits of autism. Have you seen this before? Sure, there's people who will be afraid of developing autism, which you can't do if you're older, because you would have had it already. But I hear that about schizophrenia as well too. Well, what if I develop schizophrenia or psychosis or anything? So OCD, in terms of have I seen this before? OCD can jump onto anything that it wants to and make you doubt it or wonder if something bad might happen about it. So, what about what can you tell somebody who's going through ERP and wants to quit because it's hard? Well, it is supposed to be hard. If it was easy, it would be very easy then to treat OCD, right? And anyone with OCD could just walk in, we'd give you a few ERP exercises, and you'd be like, oh, that's awesome. Thank you so much. That's great. Of course, it's difficult because OCD, of course, picks on things that are amazingly important to you and makes you doubt them. ERP puts you in the area of being okay with the doubt and accepting the uncertainty. And OCD says to you back at that, no, it is not okay to have doubt. It is not okay to accept uncertainty. You must know 100%. But the problem is that you don't know 100% about anything, much less about the thing you have OCD about. Now, it turns out you really don't care about the fact that you don't know 100% about anything, but you do care about the fact that you don't know 100% about your OCD things. So I'll go to, why is it okay not to have 100% knowledge about everything other than your OCD? But when it comes to your OCD, you must have 100% knowledge about that. Why have you created a special world where in these 99.9999999999999% of things, it's okay to not know everything. But in this 0.000000001%, I do have to know everything. It just doesn't work that way, right? That the brain, that's like explosion going off in the head kind of thing. We can't function like that. We have no 100% guarantee about absolutely anything whatsoever. And therefore, the people who are successful in life are the people who are like, yeah, okay, I'm good with that. And the people who are troubled with that go on to have OCD issues with it and really feel like, now I have to have this absolute guarantee, at least about this thing. Some to the point of saying, I don't know that I want to live without having 100% guarantee of knowing that I won't do this or that or be that or something like that. Well, every one of us in the world has the opportunity to be the very thing that your OCD tells you you can't be. We all have the potential of potentially being that thing, right? And those without OCD accept that. In fact, they probably don't even think about it. They might not have even accepted it. It's a passive acceptance because they haven't even spent time thinking about it. But they still accept it anyway. It's just in the background. They just don't care. But in OCD, you do care very much. So, oh my gosh, I'm not looking for reassurance, which totally means you're looking for reassurance, but we'll go with that. But today has been hell, feeling that I'm delusional or not feeling things right. Obviously OCD, do ERP, but any other suggestions? Be okay with feeling not right, right? There's something I've had people watch. If you go to YouTube and you type in natural hallucination, it's really cool. It's an optical illusion, and just follow the directions that it says. It gives you directions at the beginning. It tells you what to do while you're watching it. It tells you something at the end to do as well too. It's really fascinating. So I have people purposely do that and get them to get that feeling of, derealization or depersonalization or feeling out of their body or not quite themselves or something like that. There are days that everybody feels off or different, and that's okay. But when you have OCD, of course, it's not okay. It's not acceptable because I'm supposed to only operate within this small lane. I can't have much more fluctuation than about this or this much. I've got to operate in this lane. And anything that goes beyond that is unacceptable. It's bad. So, one day I might just feel a little groggy because I'm sleepy or something like that. And who knows? Those things happen. Those are normal and natural types of things. But OCD will grab onto those and say, oh, maybe it's more though. Maybe it's the worst case thing that it could possibly be. And maybe you need to now be really, really worried about that thing. When something bad happens, I think it's because of my OCD. My OCD then gets worse, and I feel like I have to listen to my intrusive thoughts to prevent more bad things from happening. What do I do? Well, I would say sit with something bad that happens and do the opposite of your intrusive thoughts, right? That would be a good ERP experience for somebody, to always think about what is the opposite thing that I'm doing. So if what I'm doing is helping my OCD, then I want to do the opposite of it, right? So think about this. Every compulsion is helpful to obsessive compulsive disorder, and everything opposite of a compulsion is helpful to getting rid of obsessive compulsive disorder. Now you must decide, what is it that you are going to do? Are you going to do the compulsion, which will lead you to feel better in the moment, but make your OCD worse? Or will you do the opposite of the compulsion, which will lead you to feel worse in the moment, but allow you to feel better later on? If you were addicted to a drug, you might continue taking the drug just because you know that when you stop taking the drug, you go through withdrawal, and withdrawal feels horrible, and you don't feel like you have the stamina to deal with the feeling of horribleness that occurs when you stop the drug. So now you might just continue taking the drug so that you don't go through withdrawal from the drug. But what's the only way to overcome drug abuse? To go through withdrawal and feel horrible now so that you can feel better later. But what does the drug abuse want? Continue taking the drug to feel good now, but as you do, your life gets progressively worse. If you think about like methamphetamine, the more that you use it, the more you feel good in the moment, but your teeth fall out, your skin gets awful, you have just awful things that happen throughout your body, your veins start to close down, and typically within about 6 or 7 years, you die. Now, if that sounds fun to anyone, I don't think it does, but if that sounds like something that you would want, that's kind of the similar kind of thing that's happening with OCD, right? Is that the more that you do the compulsion, it's like similar to addiction. The more that you're sticking into the addiction, the more you're going for what feels good in the moment instead of what's going to be best for you later on, even though to get to what's going to be best for you later on means you're going to go through a really rough period of time. You're either going to go through withdrawal of the drug, or you're going to go through the period where you stop doing what OCD wants you to do, and OCD is going to throw a tantrum like no other because it's so used to you giving what it wants that it's gonna scream and cry because it thinks, well, you must not be paying attention to me. Well, darn it, we're going to make sure that you do, and we're going to ramp it up to 11 right now, and we're going to scream and cry and yell and do whatever we can to get you to fulfill all the needs of the OCD by doing all the compulsions. And thank you again for feeding me, by the way, because I, as your OCD, feed on compulsions. That's what I want. Okay. A couple of questions about mental compulsions and intrusive thoughts. So let's look at those. I know you said live life happily and accept the intrusive thoughts just as thoughts. However, there are times they feel so real. Oh, here we are again. One of my favorite phrases. I was just talking to my therapist today about this. They feel so real. The urge is there. What if this isn't OCD? And another one down here, how do you stop mental compulsions, right? Well, let's talk about these things for a few minutes, everybody. First of all, what does feel so real mean? I want everyone to think about that for a moment. What does it mean for something to feel so real? Anybody ever go to a horror film? Anybody sit there with their big tub of popcorn on their lap, and you got your big 96-ounce pop with you, or soda, depending on where you live in the country, and you're surrounded by people you don't really know, although not so much in COVID. You're in this big auditorium, which I'm assuming almost none of you actually have in your home, with a screen that's 10 times, 20 times bigger than any television you've ever owned. And you've paid money to go to this horror film, and about 30 minutes in, somebody pops out from behind a door with a knife and just kind of does one of these things. And you get jostled and the popcorn goes flying, and you had the pop in your hand, you squeeze it really hard and it gushes all over the place. And you just paid money to have somebody scare you. And when you jumped like that, it felt so real. It felt so real. But imagine now going back to watch that horror film 20 more times. Guess what happens at the 20th time? You don't react anymore. In fact, you know it's coming, and you're looking forward to it. You're like, oh, here it comes, here it comes. Oh, yeah, there it is. That's awesome. It's the same movie. Nothing's changed. Now you're not afraid of it anymore because you allowed yourself to expose to it, and you sat with it, and you learned that you could handle that. Okay? What if you thought of your OCD like a horror film? If OCD is anything, it's predictable. And guess what? Horror films get less scary over time because they are predictable and you know what's coming. Well, it turns out OCD is really predictable too. It throws the same stuff at you all the time. Why continue to believe it when it's so predictable? Now you might say, oh, but it feels so real. Well, it has to feel real. I mean, it wouldn't be considered one of the top 10 most disabling disorders in the world if it felt, meh. Not today, OCD. Maybe tomorrow. Nah, I'm good. I'm a little tired today. I'm gonna just ignore you today. But tomorrow you might get me. That's a possibility. So, of course, it feels real. It wouldn't work as a disorder if it didn't feel real. But now here comes my challenge. Just because it feels real doesn't mean it is real. Are you going to live your life afraid of things that feel real, or would you like to live your life only being afraid of things that are real and are scary? I still have not seen a news story that leads off with person with OCD actually goes and does the thing that they are afraid of. Still haven't seen it. 21 years of treating OCD. Still haven't seen it. So, Rodolfo, you can tell me all day long how real OCD feels. And my reply is always going to be, but is it actually real? I know it feels real, but is it actually real? Anybody going on horror films, if anyone's seen the It movies, either the old ones or the new ones, I love the ending scene. In fact, sometimes I show it in my therapy sessions. I go on YouTube and I pull it up. And so here's it, the clown, and it's got the spider body and the talons and everything. And it's coming after the kids. And one of the kids, who's now an adult, in the second part of it, they say, you know how you defeat it? By not believing in it. And it goes to take a swing, and just as it gets there, it stops. And it's like, what? And it says, I'm the eater of worlds. And he goes, no, you're just a clown. And he swings at him again, but he can't hit him. He says, I'm the eater of worlds. And another one goes, you're a mimic. And another one comes up, you're just a bully. And as they start saying this, it gets smaller and smaller, and it tries to attack him, but it can't, and it gets smaller, and it's now backing away from them, and they're just going after him, going, you're a mimic, you're a clown, you're a mimic, you're a clown, you're nothing, all this kind of stuff. And at the very last scene, it's a little baby, and they take its heart out of its body, and they squeeze it, and it disintegrates into nothing. It's gone. And the only reason it's gone is because they stopped believing in it. But the more they believed in it and the more they felt it was real, the worse it was. Now, I can't live in any of your brains and truly feel what it might feel like to you for how real this is, but I can tell you that I know OCD very well. And I can tell you that no matter how it might feel real, it is a clown. It is a mimic. It is a bully. And it can't actually do anything to you or anybody else. My son won't have any relationships and always finds something wrong with the other person. I'm afraid he will remain single and be set in his OCD thoughts. Well, thank you, Rachel. It could be OCD, but it could be OCPD as well. OCPD is obsessive compulsive personality disorder, which doesn't actually have obsessions or compulsions. And in fact, it's a horrible name. It should have been called anal retentive personality disorder, actually. But in OCPD, no one else is quite good enough or does anything right, and we're good at finding fault and everything else, and we would like to tell everyone just go sit in the corner and color because I'll take care of anything because I'm the only one who could do it the right way as well too. So I don't know that that's OCD, but just from that, I'm not saying it's not, Rachel, just so you know. It's hard to say just from one little comment right there. But one of the ERP exercises that you might consider is being able to sit with something that is a flaw and work on accepting the fact that there is a flaw instead of only accepting or thinking about how wrong that flaw potentially is, right? So you might want to think about ERP for that, or talk to a therapist about that for him if that's the case. Are there any specific articles or tips you can share with your husband to help him understand your OCD? Michelle says, well, shameless self-promotion here. I wrote a book called The OCD Answer Book, which has tons of questions and answers about OCD. So that might be very helpful. Background Kaylee is out there. She'll probably put a little post of it. She's good at that. But it's called the OCD Answer Book. And that might be helpful to give you a bunch of Q&A information about obsessive compulsive disorder. So hopefully that will help. That reminds me, as I mentioned Background Kaylee, hi Background Kaylee, she sends me the Instagram questions too. So let me take a look at some of those. ERP doesn't give me anxiety or distress. What does this mean? Well, it could mean that you're doing mental compulsions while you're doing the ERP, and therefore that is what is getting in the way. So it's always important for any therapist to kind of assess to see if something like that is going on. What to do when OCD starts latching onto hobbies? Continue to do the hobbies and do them in a non-OCD way as much as possible to show OCD that you are not going to let OCD take over your hobbies and your fun time. What's the best way to handle an unwanted obsession over someone? Well, again, that would be, let's talk about that for a minute, because is there an obsession over someone? Does that mean obsessive compulsive disorder? Or are we using the word obsession as I'm thinking about someone a lot? Because for it to truly be an obsession, we want to know that there would be a compulsion as well too. So sometimes people just get really stuck on somebody and can't stop thinking about someone, but it doesn't necessarily mean obsessive compulsive disorder. So I would just want to do some more research on that one. So we'll check it out. Hi, Dr. McGrath, says Josie. I got bullied really bad when I was in high school 10 years ago, and I'm still so scared to run into someone from high school on social media. Would you consider deleting the couple of girls? I had on social media, so you're asking if some of that's a compulsion maybe. Well, I would kind of take a look at it this way. I don't know if we're talking about OCD here or not. So let me just throw that out there as a caveat. B, I had bullies from my background as well too. I've just never friended any of those people, nor do I want to see anything from them because I think they're asses. And I, to this day, want nothing to do with those people. If they ever were to come up to me and see me or something and say, hey, I apologize. I was a real jerk to you in high school. I'd shake their hand and say, thank you. I really appreciate that. And now I could go on. I wouldn't have to be their friend, but, it would be nice if I heard something like that. That would be great. But they also have no role in my life. In fact, I haven't thought about them for who knows how long until this question has come up. And I will again let them go after we're done with this question as well, too. So I would take a look at basically, how are these people still controlling your life? And what are you going to do to let them go? Sometimes people are ghosts. They stick around with you, even though they're not around. Actually, they stick around with you. And what can you do to let the ghosts go? It's kind of an important question. Someone says, I just started an OCD, but I'm struggling with some compulsions and heightened anxiety. Usually that's good, because that means that you're actually starting to face some of the stuff now. And a lot of times when you start treatment for OCD, things start to feel worse before they get better. So keep that in mind, everybody. Remember, as you start to challenge those compulsions, the OCD is going to ramp up and be like, yo, over here, you seem to be forgetting about me or ignoring me. I'd like you to not do that, so I'm going to scream louder. And just know that that's what OCD does. When I feel down, I remember the past and wish I could go back. Is this a compulsion ritual and also any sort of mental loop or ritual compulsion? I don't know that that's necessarily a compulsion ritual. I think a lot of people do that. That's kind of a normal, natural thing when we're feeling down, to think about things in the past that were good or enjoyable. So I wouldn't throw that into the compulsion world. I have harm OCD, and now that I'm not afraid of my knives anymore, my OCD is focused on inappropriately touching my kids by accident and harming them some way. Yes, Christina, OCD loves to do those types of things, saying, oh, well, you worked on the knives. Let's talk about another way then that you could screw things up in your life and hurt other people. So what I want you to do, Christina, is apply everything that you did to work on the knives to now the fear around harming your children, because frankly, the type of OCD is far less important than the therapy that you're going to do for it. So I hope that you will now take everything that you did to work on the knives and apply it to this fear around your children. And I think that you would find that that would be very helpful. Rochelle says, my doctor thinks all my medical problems are created by my OCD. How do I know what's a real problem when they just continue to get worse? I would ask if that's a medical doctor or a psychological doctor or psychiatrist. That may play a role too. Yeah, if you're only seeing one kind of doctor, it may behoove you to have both kinds, like a psychological and a medical doctor, have them sign releases to each other so they can talk to each other and kind of work out maybe what is the medical piece of this and what is the OCD piece of this as well too. I'm a college student and I want to honestly stay and get my PhD. Oh, okay, good. But OCD has been pressuring me into dropping out. It's even to the point where it convinces me that I'm not passionate about school. Okay, so I would ask what your compulsion is about that. You know, when OCD says that, what does it try to get you to do? And I would want you to do the opposite. So again, does it have to be believed when OCD tells you something? That maybe comes to the core. And the theme of a lot of the questions that we had tonight, I think that we want to really think about. Do we have to believe everything that OCD tells us? I want all of you to think about that for a moment. If none of the things that OCD has told you have come true, why do you continue to believe the OCD? And it could be out of, yeah, but what if the next time is the time that it's true, right? If that's the case, well, then we're all kind of screwed, right? I mean, because there always could be something that could go wrong, all the time. None of us are immune to something going wrong. So I'm wondering, how much concern must we put into this now? How much time must I think about the fact that maybe today's webinar isn't as good as last week's because maybe I'm not as passionate this week as I was last week. And now maybe I've wasted all of your time because maybe I don't have the level of passion this week that I did last week. I now need to create a passion meter to measure myself on a weekly basis to see if I have enough passion. And if I don't, does that mean that I shouldn't do the webinar for the week because I don't have the passion that I did the week before? Or will there be times where I will fluctuate? Some weeks I will feel more awake and energized to do the webinar, and other times it might have been a really long day. And maybe there's even days that I think, oh gosh, I'd just like to go have dinner. But no, I've got webinar. So, you know, there are times that I'm not as energized on this as there are on other times. Sure, it happens. Guess what? I'm human. It is going to always occur. There are days at work that I'm that way as well too. There are even sessions where I think, oh, that was a really good one. And then there's other ones where I go, I maybe next time try that or something, remind myself of something. Nobody can be on 100% all the time. It's never going to happen. But OCD tells you, oh, it can happen and it should happen and you should be that way. And if you're not, I'm going to beat the crap out of you for not being that way. That's what happens. Okay. So stick with that PhD. And don't let OCD ruin it for you, because then here's what would happen. If you don't get your PhD, OCD is going to turn on you later and say, you could have had a PhD. You just chose not to. You're a dropout. That's what you are. Can I, let's see. Okay. The wording's a little off here, but about sexual orientation OCD. I started to notice whenever I scrolled through TikTok, I would spot the girls first. Then I thought to myself, am I a lesbian? And then I started to think back about my life. Yeah. So, OCD will get you to recognize various things, right? And it will take even something that's a coincidence or whatever. Maybe there's just more women on TikTok, and so you notice them more. Maybe there are very attractive women. I've never been on TikTok. I have no clue what it is, honestly. To me, it's how unhip I am about, and I don't even know if hip's a word anymore, but whatever. So if I notice more men asking questions on this and their names, does that mean that maybe I'm gay? Maybe I had to go upstairs and tell Susan, guess what, hon? I know you're very sick, but I got to leave you because there were some really, really cute guy names on the webinar tonight, and I'm thinking I got to go find them. Now OCD will cause you to doubt anything. So now if one time on TikTok you're like, or even a few times, you were looking at more videos about women, maybe they were just doing things that were far more interesting than the men videos were. Does that mean that now you like women more, that you're a lesbian? When you don't have OCD, you don't think about that. But when you do, then you do think about that. Just so you know. I think I have religious OCD, and I always feel like I'm doing something wrong. Well, scrupulosity could be about that, especially if it's themed around religion. But remember, scrupulosity can be about morals or ethics as well too. So we might have moral or ethical scrupulosity, and the idea of feeling like I'm doing something wrong is pretty common in moral or ethical scrupulosity. But just because we think it, again, doesn't mean it's true. Okay. I want everyone to think about turning into a bald eagle. Let's just do that. Spend 10 seconds thinking about turning into a bald eagle. Go. Okay. I did not turn into a bald eagle. Now, I don't see any of you. Maybe you all just turned into a bald eagle. Or maybe thinking something doesn't mean things are true and make things happen. I'm going to go with probably none of you turn into a bald eagle, and therefore I'm correct. But your OCD may tell you, yeah, but what if, right? Yeah, but what if? And if you're going to live in the what if world, then anything that OCD says to you is possible, right? And because it's possible when you have OCD, it's highly probable. And maybe the difference, one of the bigger differences between people who have and don't have OCD is that people who know things are possible, when they have OCD, see them as probable. And when they don't have OCD, don't see them as probable. Because you know that when you don't have OCD, possibility doesn't equal probability. But when you have OCD, possibility does equal probability. I'm going to just scroll a little bit here and see if anybody put anything in about one of my. Someone would rather be a cat than a bald eagle. Okay. All right. Hadassah says hip isn't a word anymore. I don't think there's a direct replacement. Maybe clapped. Okay, well, thanks, because I'm obviously very, very out of the whole thing. So, okay. All right. While doing therapy and having success in getting rid of a lot of my obsessions, I seem to be having a lack of motivation daily and feeling down despite the success. Is this common? Sure, it can be common. I mean, sometimes it's hard for people to give up OCD, and that sounds weird maybe to some of you who that's your desire, but if you're used to OCD and you're used to living that way, it can be a little scary to not have that, right? It can be a little scary to not have OCD anymore because you're so used to using it as kind of your guidepost through life. You're used to obsessing about things. You're used to doing compulsions. To lose those is to lose something that's familiar and frankly maybe comfortable in some ways because you are just so used to it. So yeah, it can be rough not having OCD anymore. And it can be really great to have the success. And yet sometimes also people, when they're going through OCD treatment, might feel down because now they're starting to see a glimpse of what life might be like without OCD. And they're kind of in mourning over all of the life that they've lost to OCD. And that can be really difficult for people to deal with as well, as they sit there and kind of ponder, I did all of this stuff for my OCD. I did everything that it wanted me to do. I listened to it so very much and so very long and so very often. And I gave it everything that it asked. And what did it do for me? Maybe that's another question for all of you to ponder this week. What has OCD done for you? And if it really hasn't done anything for you, which I'm going to bet is going to be the answer for most of you, if it really hasn't done anything for any of you, well, why continue to do its bidding? Why continue to give it another chance? I have used the example lately of, and I've used it on here, I think, in the past too, but every time that Charlie Brown ran up to the football, right before he kicked it, Lucy picked up the football and Charlie Brown went flying through the air. In an interview with Charles Schulz, he said, no matter what, Lucy was never going to leave the football down for Charlie Brown to kick. She was always, no matter what, she was always going to lift the football up. Those of you with OCD are Charlie Brown. And you're hoping this time you're going to run at the football and it's going to stay down and you're going to kick it and you're finally going to get the relief that you want. But your OCD is Lucy. And Lucy's going to pick up that football every single time you go to kick it to get the relief that you want. And you go just flying, sputtering through the air, and you land on your back. And you just recognize that once again, you have been had. You have been had by your OCD one more time. But then your OCD says to you, okay, this time it didn't happen, but what if next time? What if that's really the time? Next time. So my challenge to you, When are you going to stop running after the football? When are you going to say, hey, Lucy, yeah, I see you holding the ball there. Thanks. That's great. And I'm not going there. I'm not gonna do it. I'm not gonna try to even kick it. I already know what the result's gonna be. Hey, Lucy, you're predictable. And I know that going down that path is not going to solve anything for me or make anything better. So here's the deal, Lucy. I'm done with you and your game. I'm not going to play it anymore. Okay? So there we go. Lavlana says, I don't think I need OCD's guidance anymore, right? Because the guidance that OCD gives you is like one of your GPS systems running you into a lake, right? I think of that office episode where they drove right into the lake because the GPS said that's where to go, right? So I wish for all of you a week where you will decide at least once this week that OCD is a big old liar and that you're not going to pay attention to it. That OCD is that football, or Lucy's holding that football for you, and you're not going to go down that path. And that you offer yourself the opportunity to go through a really difficult thing, which is to not do the compulsion, so that you can come out on the other side feeling stronger that you're right, you didn't do it. You didn't do it. Now, there's going to be what ifs flying at you all over the place, right? Remember, I've defined all the time anxiety, and it starts with 2 words, and those 2 words are what if, followed by the worst case scenario that you can possibly think of. No one's ever come into my office and said, Dr. McGrath, what if everyone loves me and thinks I'm awesome? Okay, nobody's ever done that. That's not what it's about. Don't get thrown off by the what if. Because OCD uses the what if as grenades that it lobs at you, right? You know, you're in your head and like, well, I'm not gonna do it. Well, what if this? And what if that? And what if grenade? Nah. They're word grenades. Has anyone ever been hurt by a word? No. With that, go challenge yourselves this week. Next week, we will have our Diversity Matters webinar. Very excited about that. We'll be doing OCD questions as well, too, but we'll also be talking with a group of therapists about some diversity issues next week in honor of Black History Month. So I'm very excited about that as well. Make it a great week, everybody. Have a good one.